Caitlin arrives at the emergency department with an ectopic pregnancy. Her condition quickly turns critical as her fallopian tube ruptures, leaking blood into her abdominal cavity. She needs immediate surgery, but she refuses an open procedure, stating she cannot afford the recovery time away from her hourly job. The surgical team prepares for a laparoscopy, but they discover the hospital is out of fiber optic cables due to supply chain issues. Without these cables, there is no light or video feed for the monitors. The screens remain black. Dr. Archer proposes a solution from a previous era. He suggests operating by looking directly through the eyepiece of the laparoscope, a manual technique not practiced since the advent of digital imaging. Archer has broken ribs and cannot perform the surgery himself. He must guide Dr. Asher through the procedure. Asher calls it performing surgery with one hand tied behind her back, but the patient's internal bleeding leaves them no other choice. In the operating room, the digital displays are useless. Asher bends over the patient, pressing her eye against the metal scope. The field of vision is microscopic and dim. Archer stands over her, dictating the exact tension required on the graspers and the placement of the needlepoint cautery. Asher struggles to find the correct angle in the dark. Archer forces her to rely on his verbal instructions and her own tactile feedback. She identifies the bulge in the left fallopian tube. Following Archer's cues, she makes the incision, clamps the hemorrhage, and removes the tissue. The bleeding stops. They complete the microinvasive surgery using only a lens and manual precision.